Aaron Farberg here again, board certified dermatologist based in Dallas, Texas, with my private practice, Bear Dermatology. And we're talking about alopecia areata. And of course, thank goodness we have JAK inhibitors to treat alopecia areata. Because I tell you, before we had these therapies available, it was like the bane of a dermatologist's existence. We hate coming upon problems that we really can't fix all that well. But, thankfully, JAK inhibitors, they really can sometimes make us look like heroes. We're not at the point where we're getting 100% efficacy 100% of the time on these patients, so there's always room to grow. But we've had various iterations of these therapies come out. Of course, the most recently, Durex. Again, I enjoy watching, these approvals come out because really you only want to be approving another drug unless or the only reason you would be approving it is because it will hopefully be better. And thankfully, Durex really has come into its own and into its own place. Of course, there's no real head-to-head, so you can't compare any of these JAK inhibitors, but when you look at the overall data, it really does achieve a higher level of efficacy in a quicker time. And that's better than what, we've had previous with other treatments, the other JAK inhibitors with alopecia areata, where it just takes a little bit more time to get that hair growth. I had a patient he was 21, off to college. And of course, comes to see me over the holidays. Oh my gosh, I'm having all these patches of hair loss, and there's a significant amount of alopecia areata. About half his hair was gone. We discussed exactly what AA really is. Of course, he's concerned. Is it his diet? Is it something he did at college? No, 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 nothing like that. It's just his immune system that's revved up. And we were able to start him on Durex as well. Now, one of the things that's interesting about that drug is that you do have to test for a gene because it is contraindicated in the CYP2C9 poor metabolizers. It's pretty rare that you come across this, but it's why you do your blood work. That's why we're all doctors here. So we did that pretty easy. Also look for any interaction drugs because there are a few of those out there, and we as much as we appreciate our pharmacists checking on all this. It's very important that we do this. In any case, started this patient on the drug, and no joke, within 1 month, we already received an email from him how excited he was that that things have already started to improve. Really, over the next 4 months, he has grown all his hair back, which is just fantastic. I mean, again, think about a young 20-something-year-old, off to college and this happening to him. That's the last thing you need, especially with all the tests and dating and everything else he's trying to do in life. This sort of hair loss was so impactful. I had another patient that I really want to bring up, though, she was a 44-year-old woman who had significant hair loss, also started on another JAK inhibitor. This was ruxolitinib. And she had done well in growing her hair back, but it really took up to like 9 months to get her to where she was happy with her hair growth. And I still remember I usually pull out the phase 3 data for these JAK inhibitors and show patients that, yes, you have improvement over a period of weeks to months. But for some patients, they don't improve until the back half of that year, really, until, after, 6 months. And so, you want to really sort of be, a ray of hope for these patients and encourage them to, continue on their therapy. Of course, now that, I have a drug like Durex, I probably would have changed them over a little bit sooner. Just knowing the efficacy and speed of that drug as well. So, those are just a couple examples of how we've been able to change lives of our patients with alopecia areata. I hope, yes, there are boxed warnings on these drugs, but I hope everyone really does their homework and understands where they came from, not to diminish the warning or the concerns, But the reality is these drugs are safe and the benefit far outweighs the risk. So if you have a patient with alopecia areata and you're not prescribing one of these treatments, then you really need to go back and do your homework, go back to school so that you can, because these are life-changing and very impactful for our patients. Thanks for listening.